Good day everyone, welcome to the breaking world news. Monkeypox is caused by the monkeypox virus, a member of the same family of viruses as smallpox, although it is much less severe and experts say chances of infection are low. It occurs mostly in remote parts of Central and West African countries, near tropical rainforests. There are two main strains of virus, West African and Central African. Two of the infected patients in the UK traveled from Nigeria, so it is likely that they are suffering from the West African strain of the virus, which is generally mild, but this is as yet unconfirmed. Another case was a healthcare worker who picked up the virus from one of the patients. 4 more recent cases, 3 in London and 1 in northeast England, do not have any known links with each other or any history of travel. It appears they caught it in the UK. The UKHSA says anyone with concerns that they could be infected should see a health professional, but make contact with the clinic or surgery ahead of a visit. What are the symptoms? Initial symptoms include fever, headaches, swellings, back pain, aching muscles, and a general listlessness. Once the fever breaks, a rash can develop, often beginning on the face, then spreading to other parts of the body, most commonly the palms of the hands and soles of the feet. The rash, which can be extremely itchy, changes and goes through different stages before finally forming a scab, which later falls off. The lesions can cause scarring. The infection usually clears up on its own and lasts between 14 and 21 days. Monkeypox. Healthcare worker as 3rd UK case of disease, Blackpool patient as 2nd UK case, monkeypox diagnosed in UK for first time. How do you catch it? Monkeypox can be spread when someone is in close contact with an infected person. The virus can enter the body through broken skin, the respiratory tract, or through the eyes, nose, or mouth. It has not previously been described as a sexually transmitted infection, but it can be passed on by direct contact during sex. It can also be spread by contact with infected animals such as monkeys, rats, and squirrels, or by virus-contaminated objects, such as bedding and clothing. How dangerous is it? Most cases of the virus are mild, sometimes resembling chickenpox, and clear up on their own within a few weeks. Monkeypox can sometimes be more severe, however, and has been reported to have caused deaths in West Africa. How common are outbreaks? The virus was first identified in a captive monkey, and since 1970 there have been sporadic outbreaks reported across 10 African countries. In 2003 there was an outbreak in the USA, the first time the disease had been seen outside of Africa. Patients caught the disease from close contact with prairie dogs that had been infected by a variety of small mammals imported into the country. A total of 81 cases were reported, but none resulted in deaths. In 2017, Nigeria experienced the largest documented outbreak, approximately 40 years after the country had its last confirmed cases of monkeypox. There were 172 suspected cases of monkeypox, and 75% of victims were males aged between 21 and 40 years old. What is the treatment? There is no treatment for monkeypox, but outbreaks can be controlled by infection prevention. Vaccination against smallpox has been proven to be 85% effective in preventing monkeypox and is still sometimes used. It has been reported that Spain is preparing to order thousands of doses of smallpox vaccine to use against monkeypox. Experts believe that vaccination after a monkeypox exposure may help prevent the disease or make it less severe. Should the public be concerned? Experts say we are not on the brink of a national outbreak and, according to Public Health England, the risk to the public is low. Professor Jonathan Ball, Professor of Molecular Virology, University of Nottingham, said, "The fact that only one of the 50 contacts of the initial monkeypox-infected patient has been infected shows how poorly infectious the virus is. It is wrong to think that we are on the brink of a nationwide outbreak." Dr. Nick Finn, Deputy Director, National Infection Service at Public Health England, FE, added, "It is important to emphasize that monkeypox does not spread easily between people and the overall risk to the general public is very low." FE is following up those who have had close contact with the patient to offer advice and to monitor them as necessary. Thanks for watching the Breaking World News. And don't forget to subscribe if you want to be informed.